This project is the right project at the right time for the right reason. We're entering into a new era of healthcare delivery, and we know that a critical part of this will be educating our patients, the family, and the public in general so that they can maintain wellness or avoid illness or cope better if they have a chronic illness. And that overall, we believe, will help us avoid them using the more expensive acute care services in the hospital and therefore contribute to a reduction in healthcare costs.
We had been diagnosed diabetic almost 20 years ago and had been managing it just fine for all of that period of time. I ended up stepping wrong and ended up getting a bone bruise. It started to develop into an infection, and being diabetic didn't help the process. But I think what we didn't understand at the time, there were signs my body was telling me, but we didn't understand them. If we'd have had the experience that we'd had for diabetic education 15, 18 years ago, I wouldn't be sitting here today like this.
We change the outcomes of diabetes with education. There's a huge difference between someone who's diagnosed and gets educated and someone who's diagnosed and never gets that education. We're going to see a huge impact on that person's health for the rest of their life. The person who gets that education, they're going to learn how to modify their diet. They're going to learn how to make simple changes. The person who never gets educated, unfortunately, they're going to have worse health outcomes. That's what we usually see.
One of the main problems I see is, although we have great physicians, their time is limited. We only have 15 minutes or so to see a patient. And these patients with diabetes, hypertension, high cholesterol, heart disease, so on and so forth, you cannot cover everything you need to. If you have an education center that they can come to, you have the opportunity to teach them each aspect of their 10 diseases, their 20 medications, all these things. Can sit down and one-on-one go through this, not as their physician, but just as an educational opportunity, so they can ask the questions they don't get to ask with their physician necessarily.
You can go onto the web today and there's tons of blog sites, and there's all kinds of cures for everything. And so the question is the quality of that. Here at the center, I see the quality and level reflecting the skill, the knowledge, the expertise that's available to us through the hospital.
If there was a place I could go and just look up the information and talk to people, it's really helpful to talk to an actual physical human being. That would be great, because you get too isolated when you're ill.
I sit down and the doctor says, you have diabetes. Okay. That's a big shock. So how do you relate to that? How do you cope with that? If you all of a sudden you have a place you know you can go, you're not so lonely. The hospital is clinical and functional, and that's what its job is. The senior centers are very social, fun, and that fits a huge need. And what I think we're doing here in the center is bringing them together and make our health care reflect both of those worlds and what they do and how they fit in our lifestyle.
Oftentimes individuals find it difficult to come back to the hospital after they've had a procedure or treatment or even an appointment, where even it might be the most wonderful experience, it still elicits some anxiety and stress to return to the hospital for a support group or educational opportunity. So having the health center, which is in a non-clinical setting, a very comfortable, inviting environment, would be optimal. And it may encourage more people to participate in some of the programs that are offered.
It's one thing to tell someone in a clinic, lose weight, burn calories, don't eat as much. It's another thing to go to a setting where you can sit around in a classroom, be shown how to cook, be shown exercise techniques, things like weigh yourself daily and so on and so forth. Those things where you get instruction hands-on are the key. It's not telling somebody in a clinic in 5 minutes what they have to do.
I would love to see a lobby with people sitting and reading literature and finding more about supports and resources that are available to them and their loved ones. Volunteers who are coming forward and bringing forth their knowledge and offering programs, as well as professional staff bringing forth their resources as well.
I think that once we're right there on the highway, we do have that physical presence. I think it will flag down to people that this is a place where you are welcome to come for education. which is a lot different than the space we're working in right now, where we kind of borrow different rooms for our classes. We definitely are in need of expanding, and a lot of our classes fall into that little room. People are sitting on the side, they can't even see on the board what we're writing. It's so hot that we leave the door open and the fan on. I don't think it's very conducive to education.
I have to start several months ahead of a class hunting for space because it has to be free, it has to be handicapped accessible, we have to have enough space to put up a whiteboard or a pad of paper for all the things we write, we have to display posters. I mean, it just gets to be a real hunt, and if we had the center to turn to always, what a relief. I tell you, we could concentrate on other things. It would just be wonderful.
Quite frankly, a venue is important, and when I go to medical conferences, say at Johns Hopkins or Harvard, there's something about sitting in that forum where you're in a lecture hall that is set up for this and is meant to be, rather than pulling a bunch of chairs and coffee tables and lunchroom tables around and trying to make it seem as though we're here for a conference, when it just doesn't have the feel that this is truly about education.
This is a great opportunity for our area, not just for the residents that live here, but for people that it will bring to the area. We expect that there would be a significant economic impact with the meetings and conventions and conferences and trainings that it will bring people to the area for. If you have a full-on event which could be capable of having as many as 200 attendees and perhaps even their families come to the area for a 3-day conference, there could be $3,000 to $4,000 in room tax revenue generated from that stay, from that conference. And if you have several of those a year, the impact could be very significant on our city coffers with the room tax collections. It's estimated currently that when a person visits Newport and they stay over, that they spend an average of $137 per day per person while they're here on retail, dining, shopping, and other activities. People that attend conferences also are more likely to return to the area if they find it a pleasurable experience when they're here to explore further. So it has repeat impact as well economically. Newport is rapidly becoming known as a marine science hub for the entire West Coast. There's nothing to stop us from becoming the healthcare hub of the West Coast as well. This is the beginning of something that could be very big for our region.
Well, the center will help prevent disease, help us manage chronic illness conditions, help improve the quality of health, and ultimately lower the cost of healthcare.
We need to start in our small community, have an education center, have this be effective, and have it be something where it means a lot to our community. And to do that, we need the money, and we need to put it out there. I wholeheartedly support it, and I've given to it, and I will continue to.